But as we embody health and wellness and recognize that without us healing, we can't move forward, let us close the space with a good woosah! Ashe, ashe.
So the Health and Wellness Committee is one of a few IFAs, impact focus areas, that commissioners, there's about 35 commissioners, folks, that are on the greater commissioning body that meet at least once a month. And with that, different individuals are in different focus areas. We are a small but mighty group. Dr. Tamare Macon was not able to be here today because of a family emergency, but she's been pivotal. We also had another member earlier that was not able to continue. But one of the things, if you look at the walls there, we have used a process called technology and participation, and it meant that we had opportunities to sit and brainstorm ideas when it came to recommendations around health spaces. The first part, and I invite you all during a break to kind of look at the work. I know it looks a little beat up, but that's because we put it to good use. Down at the first section, we did what we called a historical scan. And that was with us really trying to develop and understand what the environment was from the 1800s as far as the local, state, and national environment. What kind of legislation kind of laid the way for disparities and issues around health? And so we've gone through that. There are green Post-it notes because unfortunately, North Carolina had a lot of issues around disparities and causing harm to those, particularly black bodies in North Carolina. So we talk about eugenics. We talked about the fact that there were many pastors that were initially after Reconstruction consulted about how we could do things. And not many people may know that after Reconstruction, we had more African American legislators in North Carolina than any other state. People also don't know though that caused fear in many white community members back then, and then you strategically put in Jim Crow laws and other restrictions that then harmed them and thus harmed the greater black community. So we go back all the way to that, and then you go up through eugenics, we go up through all kinds of things that happened in North Carolina on a national stage. The Tuskegee experiments, a lot of that again caused harm but also laid the groundwork for the continuation of harm. So then we also decided, what if we're going to do reparations here, and if people really are interested in reparations, what does that mean? It means that we have to really address the systemic harms, the legislation, the history behind it, and then how do we move forward, and how do we hold those perpetuating that harm accountable, and how do we put policies and procedures and things in place to stop the harms. So that's really all of what we're talking about when we're reparations. Now, again, the big debate is, we know that people are wondering, well, are people going to actually get monetary compensation? Because most original conversations around reparations have been that. You all probably are aware, being in Buncombe County, that in 2020, the city of Asheville issued a formal apology and said that they would be supportive and provide funding for reparation initiatives. Did that mean actually compensating individuals? No. But we are hopeful that all of us working together will then be able to concentrate on what we can do, what programs and initiatives health and wellness can support. And when we, I love the fact that we opened with the altar. Tiffany and I were just talking about the fact that how do we look at providing health to all black and brown bodies in Buncombe County in a way where the disparities have prohibited that. Particularly, one of the things that health and wellness has come up with, and you'll see again some of this work, is the fact that through our brainstorming and working together as a group, organically you saw different themes emerge. And one of the big ones was indeed, how do we support and reclaim and reinvent black healing spaces? What can we do to create black healing spaces in this area, whether they occurred at some point or not? We're also looking at multiple data streams. We're really grateful to Ginger and others from Buncombe County Health Department, Health and Human Services, that are really helping us look at data, like what happened to Black midwives, what happened to Black hospitals. There were Black hospitals or Black healing spaces in Buncombe County. Why don't those exist anymore? And what can we do to support those initiatives being reestablished? So the Health and Wellness Group has been really kind of busy. And the other thing, though, I wanted to ask you all to do is we just want to make sure that we're not leaving anything out. This is a great opportunity. You have Post-it notes. I'd be interested in you all just jotting down something if you think that Health and Wellness should do it. I think we, at one of the commissioners' meetings, we also talked about what was absent. And I believe Dwayne was wonderful in saying, have you all thought about the environment? We hadn't thought about the environment. So we took notes and we're going to put that up there. So we're really interested in having this opportunity for you all to say, have you thought about this? Have you thought about that? And we can take it under advisement as we look at what the opportunities are. Now, the other thing about reparations in general, and again, I'm not with the city of Asheville and I'm not going to just give blanket statements here. We don't have a lot of understanding yet. There's a lot of work to do. We don't have a lot of understanding yet of exactly the amount of money that's going to go toward funding some of this. We have multiple, again, economic development, education, housing, our health and wellness IFA. We have multiple working groups that are doing this work. And we have like 30 to 40 some potential recommendations under 9 categories. When we talk about those categories, one, the provision of free access to health care. We know that there's still individuals that don't have access to health care. And what does that mean? The elimination of bias and implementing accountability of staff and providers. We know that oftentimes Black and brown bodies go into a healthcare system and they're not treated fairly. So how do we get that eliminated? How do we stop that harm when people seek health care? Does it mean that we ask and require mandatory training for everybody, not just because, and I guess in my other role as the Senior Director of Innovation and Equity Development for Impact Health, when we talk about EDI, that's wonderful, but let's make it stronger than EDI. Let's make it anti-racism training, because EDI kind of waters it down. So we need to look at doing that as well in our healthcare settings. So how do we hold practitioners accountable? How do we, again, stop the harms that sometimes happen when people come into healing spaces when they're expecting equitable care and unfortunately they're not getting it? So we're also looking at, again, stopping the harms, decreasing barriers to access. Another category that emerged, and again, I'm looking at pages, and we'll be putting a lot of this information on the websites regarding reparations and health and wellness, but also African American healing spaces. Again, Black-owned health centers, including birthing centers, was one of the big priorities. How do we look at birth rates? How do we look at the fact that unfortunately Black and brown bodies, women are still having more difficulties with giving birth, successfully giving birth than any other demographic. We should not be having that happen here. Anywhere. African American representation and decision making. The big thing behind this, and I think Rob has spoken to this on a regular occasion here, is when do we have Black and brown bodies at decision-making tables? It's okay to say we're including you when we talk about planning for the health of a region. It's another thing to really implement what the suggestions are. I've noticed, and again, I'm not always the most popular voice in the room, but we have folks that say, oh, we're going to have you come to the table and share your ideas, only to find out that there was already an agenda. We need to get rid of that in order to be equal at the table. There needs to be also some ownership that, yes, we need to have everybody at the table who's invited have an equal part in the decision-making, the outcomes of those meetings. We also have, and again, there are lots of categories. We've been busy. They've been really busy. Utilizing city, county, leveraging those resources. What does that look like? I'm excited that the city of Asheville and Buncombe County are working together on this. it means, just like this event here, that sometimes we have to work together whether we like to or not. And I'm saying that fondly. We've had some conversations about this in the room. But if we're looking at outcomes for everybody in Buncombe County, doesn't that mean that all of our legislative bodies need to work in cooperation with health and wellness and other IFAs in order for us to be successful? It's not just about health and wellness. We know that we also have intersections with housing. When we talk about, in my role and other roles, we talk about social determinants of health. Only the 20% deals with physical health. The other 80%, all of those other things that affect somebody. Transportation. Can you get your appointments? Do you have running transportation? Do you have healthy housing? Or do you have housing that is in need of repair and is hurting you? Do you have access to not just food, but healthy food, healthy fruits and vegetables? All of those are considered social determinants of health. And we're thinking about all of that in health and wellness, but how can we put all of this in and equity in all of our recommendations? Yes, ma'am.
But even in these systems that we currently have, which is welfare system, healthcare, which is like clinics in Black neighborhoods, it's still the value and the quality is
Correct.
not there to give us that piece of life that we need to get to that next level.
The accountability piece. When we see that the care, and I know many of you in the room, and we've had conversations about the health care you've received in Buncombe County and whether or not that was adequate. I know people who said they've taken their children to Mission Hospital, I'm sorry, I'm calling it, and people were not happy with the fact that their children were not received well or they didn't get the help they needed. And I'm not saying that's running the gamut for everybody at Mission, so I'm sorry. I'm just saying that there are instances where Black and brown bodies seem to not get that health care they need, the access, and then when they ask for it, they're considered complaining and they're ignored. We have got to start holding our systems accountable for that. We also know that a part of health and wellness is also talked about how do we make sure we're recruiting. I am really tired of people telling me we can't find Black doctors, nurses, and practitioners. We're not looking in the correct spaces. We can find anybody else we want to. And now, particularly with Asheville being the richest city in North Carolina, surpassing Charlotte in the RDU area, there's no excuse. So some of the work that we're doing is really around accountability, to your point, Tiffany, and others, which we have not always held systems accountable. But this is a great opportunity for us, greater numbers, to have the voices heard. And two more, the compensation with resources and funding, training, and education. Again, reparations is also always involved compensation. That's something that's a heated debate. Wherever people stand on the side of compensation to Black and brown bodies, Black bodies, because of the vestiges of slavery, and in order to boost those opportunities for generational wealth, we have been able to compensate other demographics. We have been able to compensate Asian Americans for internment. We have compensated other groups. It is not something that should be deemed unfair, particularly when this country was built on the backs of Black bodies. So again, the jury is out within Buncombe County about whether or not there will be actual cash reparations, but we are one of a handful of cities that are working to try to figure this out. Health and wellness, I don't know, ladies, what else do we need to say about it? We've been very busy. We're trying to narrow down some of our recommendations or potential recommendations as we're getting support from the county with data requests to support this. The other thing is we know also that some things, interestingly, may be challenging because of current legislation. For example, if we were interested in seeing a Black healing space occur, there might be challenges because of just can you have a race-based system when the country works so much to not have that. But we're trying to figure out, though, then what are the opportunities for there to be some prioritizing of care and services provided to African Americans. So We've been very busy. One of the things that we are doing is we've asked the question, what programs are already being funded? What's already in existence? And then can we get that data from everybody to build on that? But the other piece that you're correct about is that we can leverage resources. You're talking to a federal grant writer who's written about $78 million worth of funded proposals. And you're right, we don't have to stay within this region. We can go national. So as soon as we get a chance to wind down, and it means partnering with an economic development IFA, with the housing IFA, how can we leverage resources and all of this communal knowledge to be able to put together those big proposals where we don't have to depend upon funding that exists just in Buncombe County?
As you were speaking, I heard you reference black and brown, and I wanted to know what you meant by brown.
I'm sorry?
Who are you talking about when you say brown?
African Americans, but we also know primarily reparations in the past have specifically targeted black bodies.
Mm-hmm.
But I also include brown because I understand also that those that may not identify as African Americans, again, I don't like divisiveness when we look at folks of color, BIPOC individuals.
Mm-hmm.
So I understand that those reparation recommendations that generally will positively affect black bodies will also positively affect brown bodies.
Okay, and the reason why I wanted to ask is because I think it's important for us to differentiate.
Mm-hmm.
And the moment I say that, and the one thing that stuck out very quickly is when we talk about birth, black women are more
Yes.
likely to die, where Latinas, which I think are considered brown, are not.
Right.
We actually have the highest percentage of birthing.
Yes, you do.
In besides white women, we even beat white women to birthing. And so I just wanted to make sure that we create those distinctions, because
Yes.
there are moments in where Latinos don't need to be a part of that conversation, because we too are having our own different conversations, and we put the focus in African American and black people.
Yes, that's the primary focus, yes. I just don't like to be divisive. So I think sometimes systems try to divide us when we're stronger together. But
Yeah.
thank you for
But
that.
the same both and is what I'm saying. Yeah.
Exactly.
All the things that you talk about, I agree with that. But we live in a capitalistic society, and the only thing that can solve all these ills that we have is money.
And it's one of the bottom line conversations around reparations in any city that's saying it's going to try to do some kind of reparations initiative. We have to look at all of that. We have to look at how we can work together to pull our resources, because also sometimes all of us don't work together in the same sandbox, play together well. We have to get through some of that and pull our resources, leverage our resources, and then also acknowledge the fact that our future doesn't mean the funding has to come from this county alone. That there are many other funding entities and many other funding models. And I guess, again, because I work in funding areas, I talk about empowerment versus control. Are organizations empowered to do the work that they're driven and wish to do, or is it controlled by funders? But I'm in conversations about the pipeline. Again,
Right.
where is the pipeline?
Yep.
And are we reaching out to high school students? Are we really reaching out to middle school students and starting them to think about, do they wish to go into medicine as a practice? My hope is that at some point, when we are really putting these things into action, sooner than later, that commissioners will also be asked, so that we can have additional representation of black bodies on some of these accountability teams within hospital, within medical systems, because that's missing. If we look at the leadership of most of our medical systems, oftentimes it doesn't look like many of the black bodies here. And so that needs to change. What I'd like to do is invite all of you all back to the Health and Wellness IFA. Again, we meet at Stevens Lee about every other Tuesday. It's a neat opportunity for you to share your voices and your opinions. Thank you all. Thank you for giving us the time.